Hi, I would like to introduce myself, my office, and what I do. I'm Dr. David B. Fox, a chiropractic physician located at 429 Park Avenue West in Mansfield. I graduated number 2 in my class from Logan Chiropractic College in Chesterfield, Missouri in December of 1980 with a Bachelor of Science and a Doctor of Chiropractic. I use chiropractic adjustments and whole food phytonutrients by standard process to help patients regain their normal health in my practice. I do this by determining what their body is lacking and is in need of. I have practiced for over 35 years and have learned a lot in practice and postgraduate courses in chiropractic adjusting and nutrition. To determine if a patient has a subluxation, that's a malpositioned vertebrae that can cause pain, numbness, weak muscles, and more, I use palpation, feel with my fingers, leg length check to see if one's shorter than the other, and muscle testing. Like I said just there, palpation is I use my fingers to feel what vertebrae are malpositioned. Leg length is one leg is shorter than the other. There is a subluxation unless the patient has a genetic or acquired short leg. Muscle testing is if I touch a vertebrae or a muscle that has an irritation, the patient's test muscle will not lock. The techniques I use are diversified, activator method, drop table, and applied kinesiology. The diversified's manual. In this I determine which way the vertebrae needs to move and reposition it with a force from my hands. Activator method, I use a low force adjusting tool, and that force can be adjusted to adjust the vertebrae. Drop table, this is a table in which you cock it up in the table under the area to be treated. You then push on the vertebrae to reposition it. When the table stops, the vertebrae keeps going and into place. Applied kinesiology, I use this to determine a problem with a muscle or vertebrae and what to do to correct it. The test I use to determine nutritional needs are contact reflex analysis, nutritional response testing, and the Zyto machine. And if needed, I'll do blood work. Contact reflex analysis and nutritional response testing, you use a contact point on the body that correlate with the organs and the patient's normal muscle to test it. If an organ test point or muscle or vertebrae is not right, there is excess energy in that area that is touched, which makes the patient's strong arm go weak. This signifies a problem. Then when the proper nutrition is added, the arm becomes strong. Zyto balance machine, this is a machine that uses the same electrical impulses that a lie detector does. But it asks the body what organs are not up to normal, and it tells us what nutrition to use to repair them. Now blood work, if necessary, we get blood work and analyze it to see if there's any abnormalities. This may be normal in some patients that are not advanced enough with their problem. The CRA, NRT, and Zyto will show an abnormality at any stage of the disease process. An interesting fact that I learned from 3 different sources, a seminar, a book, and a newsletter, is called epigenetics. What epigenetics means is the expression of your genes can be controlled by your environment. The old thought was if your family history showed a defect, you would get it also. Examples would be diabetes, heart attack, etc. An example of this could be someone whose parents or relatives were diabetic, and if the child ate wrong, that would affect the genes and bring out the diabetes. If they ate correctly, the diabetic genes would stay suppressed and they wouldn't get diabetes. This applies to a lot of, if not most of our maladies or diseases today. There are other factors besides diet and nutrition that can affect your gene expression. There are environmental factors such as heavy metal toxicity, chemical exposure, electromagnetic fields, processed foods, GMOs, emotional and immune stresses, etc. The less of these you have, the better you are. The best would be to have none at all. That might be very difficult or impossible to do, but if you reduce them, it's going to help you. The seminar I took on this taught me how to test and correct these abnormalities on the cellular level. My other seminars taught me how to test and treat on the organ level. The cellular level will show a lot sooner than the organ level. Both systems will help heal the patient. This is just part of what they call energy medicine. Some of the chiropractic abnormalities I deal with are headache, stiff neck, subluxation, pain in the neck, mid-back, ribs, low back, pelvis, shoulder, elbow, wrist, legs, knee, ankle, TMJs, sciatica, etc. I can test a patient to determine if their problem is a subluxation, a muscle, etc. If it's structural, just needs adjusting, or if a nutritional problem causing the vertebrae to subluxate, I use a test called priority mode test to determine this. This shows a nutritional problem that is causing the subluxation. It will keep reoccurring until the nutritional deficiency is corrected. This would be called a persistent subluxation. The patient is in more than one time a week. They just keep coming in. Another thing that can happen, the exception to this rule is if they have a bad trauma, like a car accident or a fall, etc., this would normally take more treatment than normal. If you think you have a spinal or nutritional problem and are not sure, please give my office a call at 419-524-2255. I can test you to see if you have something wrong or if it's a normal thing before it gets out of hand. Better safe than sorry. Also, what is your health worth to you? What if you can't do what you want to do when you get older, with your family, friends, yourself, and especially your significant other? Or what if your life ends too soon? A heart attack may not give a symptom or one have any notice of it. In some cases, the symptom is the heart attack, and your survival chances are not as good then. There's so many things out there to do us in. Why not fix the things that can be fixed so we have a better chance of survival? I have two more items of interest, I promise. I saw on television the other day a report in the news that says vitamins can harm you, which I do agree. There are a lot of vitamins, or so-called vitamins out there. There are synthetic vitamins, man-made, which lack important nutrients and cofactors, and whole food organic supplements grown on nutrient-rich soil, not man-made. Which do you think is better? You're right, the organic whole food supplement grown on nutrient-rich soil. One of our many problems is the crops we eat are grown on depleted soil. How good is that crop for us if it lacks nutrients? The crops and the nutrition grown on good soil have all the necessary nutrients that God and nature intended us to have. When man tries to make a vitamin on his own, it is always lacking and does not work the same as one grown on nutritive soil. That is why I use standard process phytonutrients for my patients. Dr. Royal Lee, who founded Standard Process, said in 1929 that our food is lacking proper nutrients and everyone needs to supplement their diet. That is why he developed Catalin, a multivitamin, in 1929. That is why when medicine tests to see how supplements may help heart disease or other diseases, they use synthetic supplements not knowing the difference, and the tests fail. Last tidbit. Finally, I know I've seen recently commercials on TV by lawyers that want people to call them if they took certain medications and had something bad happen to them. One of these was a blood thinner, one was a proton pump inhibitor to lower your stomach acid, etc. Wouldn't you rather try an alternative method that is conservative and no side effects? This is the end. Amen. If you have any problems I mentioned or something I did not mention, call me at 419-524-2255 to schedule an appointment to see if I can help you. Thank you.